Olena, and after 6 surgeries, I am left with what I call chesticles. Because it's like a little thing, hanging off my chest. I was actually born in Ukraine. I started noticing that my breasts weren't growing like everybody else's were. I actually ended up losing one of my best friends because she told me that she doesn't want to hang out with me because the boys probably not gonna like me without the breast. And I remember telling my grandma and my mom that I wanted to just fit in and be like one of the other girls. It was my dream that one day I will have breasts finally. Everybody was saying that if you drink milk, because it has hormones in it, that will help your breasts grow. So every day I would drink at least a couple glasses of milk. Unfortunately, that didn't really help. At about 15 years old, me, my mom, and my brother moved to America. I was so excited. I knew that there's a surgery to get breasts. On my 25th birthday, I got myself breast implants. After my first surgery, the pain was really bad. My left side was throbbing, burning. When I told my doctor, he said, you have developed a capsular contracture and the only way to fix it is to replace your implants. After my second surgery, it was the exact same problem. I told my husband we couldn't trust the first doctor anymore, so we found another doctor. He did capsulectomy. Unfortunately, my left side was getting more swollen, more painful. So we went to the doctor again. His suggestion was to take my breast implants out and let my body heal. It took 6 months for my body to be ready for another surgery. So we went in and we had my breast implants put in. When I got out of the shower, I realized that the stitches came out. It was about 2 inches of black hole in there. I dropped on the floor. I was numb. I couldn't talk. I was calling my husband and he said, come help me, I think it's coming out. We drove to the family care emergency room. I just remember the nurse was so scared. She was just shivering and trembling. They must have stapled me over 30 times. The next morning, my doctor said that implant is infected. It has to come out. At that point, I told him, take them both out. I'm done. If it was up to my husband, he would probably not even let me do the first surgery. I thought about my body possibly not wanting the implants in it. Maybe there's something in my left side that's a little bit weaker than on my right side of the body, and that's why I kept rejecting the implant every single time. I am definitely afraid that it will happen again. I'm really hoping that doctors have heard or have done maybe a new procedure that will prevent a lot of the complications that I've had. Dr. Nassif and Dr. Dubrow are my last hope.
As you know, the more surgeries you've had, the more difficult the case it can be, right? Mm-hmm. This is a patient who has had 6 previous breast surgeries that required her to go to the emergency room a couple times. Let me show you what her current state is right now. She has.
Boy.
Right, so you can see she's got a lot of scarring, she's got a contracted left breast with very little soft tissue covering. It's a super high risk case.
Can you please send in Olena? Olena?
Hello.
How are you, Dr.
Good.
Nassif?
Nice to meet you.
Hi, I'm Terry
Hello.
Dubrow.
Meeting with Dr. Dubrow and Dr. Nassif today is a little scared because of so many complications I had with my past surgeries. This is definitely my last chance in getting my breast fixed.
You have a unique set of situations that put you potentially in a very, very high-risk category. What happened to you specifically?
The day after my first surgery, I noticed my left side was a little bit higher and it was more painful, and the doctor said that, it might be encapsulating.
The day
very
after
next
surgery,
day, yeah.
encapsulating?
The very next day.
You most definitely had a bleed. That's called a hematoma,
Oh, okay.
which needs to be evacuated.
Second surgery, same pain on the left side.
So 2 hematomas, what's next?
We decided to go see a different doctor. He just did a capsulectomy, I believe, on one side, and everything was great.
A capsulectomy is when you remove the scar tissue, allowing the implant to sit into the pocket softly and have a nice shape.
I guess when he was doing the capsulectomy, he had torn through the chest cavity, and so he had to put a straw and suck air out of her chest.
They're just little things.
You know.
That's called a pneumothorax commonly called a collapsed lung.
Yeah.
That is a surgical emergency. That is a very scary thing.
So just little glitch, right?
A pneumothorax can be deadly. It can kill you. If it's not treated properly, the lung can collapse. Then basically your heart stops and you die. She's lucky to be alive.
5-6 months after, it was red, painful, swollen. We went to the doctor and he sent me for an ultrasound. Ultrasound showed fluid.
So you had a seroma. Did you read a book on complications of breast
Yeah.
augmentation
Yeah, I
surgery,
wanted to make
and
sure
then
I
you
get
just checked
everything, yeah.
every single one? I mean, the only thing that hasn't happened to you is that the stitches opened up
Oh,
and the
wait.
implant popped out.
Oh, wait.
Oh, wait, we're
No.
not done with the story. A week after my stitches opened up, I had a hole about this big under my breast.
Kidding me.
No, the doctor said the implant, that it has to go, it has to come out. It's
he's
infected.
right. Yeah.
So right there, I told him, just take both of them out. I'm done. I can't deal with this anymore.
Olena, you have suffered every major complication known to breast augmentation surgery, and a couple of which were potentially life-threatening. Aren't you afraid of having more surgery?
I am, but I don't know, you guys are the best. You guys are my last chance.
I think this is a good time to go and examine you and see what's going on with the anatomy. Olena had so many problems and they were so significant. She actually may not be fixable and may not be a candidate for surgery. This is what's going on with you. You have soft tissue in this right breast. So this is an expandable breast. But the real action is in this left. So in the upper portion, you do have some soft tissue. It can be expanded out. The real issue, though, is this lower portion. The skin is directly adherent to the chest wall. I'll bet you it's right in there that they got into your lung space because there's no soft tissue. The soft tissue in the lower part of Olena's left breast has atrophied, and that's due to the complications and the multiple previous surgeries. One of the most important things you need when you put an implant in is good soft tissue coverage, and Olena doesn't have any. There have been recent innovations, these meshes that are absorbable that could reinforce the inside of the pocket. We could theoretically get away with a small breast implant in there. But I think your chance of having an encapsulation, even doing everything properly, is probably 40 to 50%.
Okay.
I think your chance of having a collapsed lung is 20%. It's virtually impossible to know where the pocket ends and the lung begins, so the chance of collapsing the lung again is extremely high, and that is really scary. You sure you want to take this risk? You want to take these chances?
I mean, is this at the highest risk within your bandwidth of what you would do?
Yeah, this is it.
Lena having another surgery is certainly worrisome to me. The possibilities for complications as well as the risks during surgery really scare me. In fact, they make me feel like I'm having a hard time breathing.
I think I'm willing to take the chances.
Couldn't scare you out of this, huh?
Nope.
I tried.
I want to try. I waited for this so long, and you guys have a tiny bit of, confidence that everything will be good, then I will go with that tiny bit of confidence. I thought about my body possibly not wanting the implants in it, but I have a good feeling. I know Dr. Dubrow, Dr. Nassif would not suggest something that's absolutely wrong to do.
I think you should do it.
Okay.
Because it's him doing it.
And I appreciate you saying that, I really do. I'm finding you very attractive at the moment.
Thank you so much.
Pleasure meeting you guys.
Thank you so much.
See you guys.
You okay? Love you both.
It's scary, but I want to do it,
I know.
Any husband wants the best for their wives, and this is something that I really hope works out for her.
I think it's exciting. I think it'll be good.
Yeah.
We just have to think positive about it.
Yeah. Love
It'll
you.
be fun. Thanks.
Excited?
Yes, so excited. I'm so nervous. When I wake up from my surgery today, I just want to have 2 normal-looking boobs that don't look like chesticles hanging off my chest. That's all.
Number 7 is my lucky number, I guess. I don't know.
Yeah.
I'd like to take you back for surgery.
Okay.
I love you. Good luck. Thank you.
You're welcome.
I'm trying to remind myself to stay positive, but I start thinking about the what ifs, and really I try and push those out of my mind because she's got the best doctor to do this, and I'm really hopeful that this will be the absolute last surgery she'll ever have to do.
Olena.
Hi.
Olena's basically had every severe complication you can have from breast implant surgery. I mean, every disaster you want to avoid, she has absolutely had. This side is sort of a reasonable situation with some soft tissue, just as long as we don't go too full. This side, however, has been severely contracted. Right here, she's right attached to the chest wall. So if we're gonna put a piece of mesh, it would be to reinforce this. And I know you want me to go as full as possible, right?
I really don't care. Whatever
Okay.
you think is the best. Could be a B, could be an A.
Really?
Could be a C.
You just want
A
something.
Z. I don't know if you think Z looks good.
Okay, Z? All right, very good. Let's do this, okay? All right, good. For Olena's surgery today, I'll begin by making incisions below her areolas and slowly elevating up the soft tissue overlying the chest wall to create pockets for her implants. I will then use sizers to determine the appropriate implants. Then on her left side, I'll use a new type of prefabricated sculpted mesh to reinforce the pocket before putting in ultra high profile implants in both sides, giving her the feminine figure she desires.
How are you? Nice to see you.
how are you?
How you doing?
See you.
After the surgery, it's so amazing to feel something there and know something good is happening in there.
So, pain-wise, how are you?
I'm good. I think my right side is at about 2.
Yeah?
My left side is at
4.
about 4.
Yeah, good. Right one opened up the pocket. The left one obviously was the problem child. Was able to elevate up the soft tissue. It was very thin. I reinforced it with this brand new kind of absorbable mesh. Very cool, new technology. I put in a 310cc ultra high profile,
Okay.
brand new type of implant.
Both sides.
Both sides.
Since surgery, Lena's been on cloud 9. She's like a completely different woman. I can't tell you how exciting it is just to see that happiness back in her face, you know.
Good.
That's crazy. That's
Yeah.
310?
310s.
Oh my God.
Seems why? Seems small?
No, it seems big.
Seems big? Good.
I mean, like in a good way, you know?
Yeah. You can see these are fitting comfortably. They're pretty happy in there right now.
I can't believe the doctors were able to fix them, and I'm just hoping there's gonna be no complications and nothing gets encapsulated. Babies.
Good spot right now. Cautiously optimistic, okay?
Yes.
Yeah, okay.
All right, very good. Thank you.
Thank you so much.
Sure.
Thinking back to all of the complications that I had in the past with every single surgery I had, I was afraid
My body couldn't have breast implants on the left side.
But after my 7th surgery, my breasts look great. So it's the best thing ever. Everything feels great and everything makes me feel sexy. Today is a very special day because Willis and I had finally decided to take a weekend away from the kids and just be with each other. The last time I actually enjoyed putting a sexy swimsuit for my husband, it was our honeymoon 5 years ago.
Oh my gosh. You look absolutely amazing, Olga. Lena's happiness means the world to me. It's just so great to see her really excited about herself. It's just the best thing I think ever.
Are you enjoying the view?
Very much so.
This view?
Yes. You look fantastic.
Thank you.
Oh my gosh.
Before the surgery, I had no breast, and my left one looked like a chesticle because my nipple was hanging off. But now, thanks to Dr. Dubrow, I have breasts finally. I'm done with breast surgery. 7 surgeries later, and look at me. Everything is beautiful, everything is healing.
I know.
And I feel so sexy too. It's just
You are. You're
amazing.
Yeah.
You know,
You look great.
7 times the charm.
7 times the charm.